Hi, I'm Ian Perry, your president and CEO here at the ABC Medical Center, and I'd like to thank you for taking the time to be here with me today. And always remember, I'm first and foremost your advocate, because this company would be nothing without our greatest asset, the employee. I've invited you here today to talk about some groundbreaking progress we're making into the digital world. But first, let's talk numbers. In 2 surveys we administered to a random sample of our staff and clients, we uncovered some surprising results. And it turns out you shouldn't feel alone if you felt unsatisfied in the process with which you complete your documentation. In fact, over 80% of our clinical staff thinks that documentation and medical record management is excessively time-consuming and cumbersome. In addition to that, 60% of our clients are disappointed by the lack of access and interoperability that they have, reporting that in this day and age, they should be able to access and monitor their records via mobile phone. So after months of research and development, we're proud to say that we have finally completed our plan to transition to what we found was the best electronic health record solution for your needs. Across these hours of analysis, we've tested many systems available and decided that spending the time and money to develop our own system would be the best option for our needs. The new system is called ABC Medical Companion, and we're very excited to introduce it to you. Here's what it offers you. Documentation simplification. With streamlined documentation formats and user interface, we expect greater ease of access and completion of your charting. Communication. Secure clinical e-messaging between all medical staff and patients who have a portal login allows for quicker and easier information relay. Result management. Real-time diagnostic results retrieval from our partnering labs and diagnostic centers. Automation. HIPAA-compliant interoperability and information management tools designed to reduce the amount of labor required by our practitioners. Patient outcomes. The patient access and input options to increase follow-through and improve well-being, encouraging e-patients, which are engaged, equipped, empowered, and enabled. More on that later. Social media linking for sharing, educating, and community outreach. Also more on this later. Support staff. Most importantly, we've created a 24/7 help desk team to ensure a smooth transition, and we would love your feedback on areas that we can improve. And finally, evolution. This system will grow and change to meet our needs, just like our organization has done over the past 12 years. Now that I've hopefully opened your mind to the world of possibilities, let's go over the 8 steps of our implementation process. First, we've analyzed our needs and researched the options available to us for the implementation of an electronic health record system. We've planned accordingly to the results of the analysis. Third, we've chosen to develop our software. Fourth, we've tested the software to work out any bugs that we can find. Fifth, we've chosen a date to go live, which is set for June 15th, 2021. And we have a committee dedicated to ensuring that we are prepared for this transition. Sixth, the committee will ensure that we maintain our system and that it evolves as our needs do. Seventh, we will continue to evaluate our system and our needs through surveys and subjective reports from you, the users of our systems. And 8, finally, we will continue to reassess and analyze the efficacy of our system and its impact on employee and client satisfaction. With our newfound access to social media platforms, we'll be able to have a greater impact on the community that we serve. For example, we'll cover various community concerns on these platforms, such as mental health and well-being, weight loss and physical well-being, smoking cessation and the new alternatives to smoking, medication compliance issues, legal compliance issues, health alerts, for example, outbreaks of illness, public safety concerns, and much more. We will be utilizing various platforms, each in different ways. For example, Facebook will be used for sharing news and in-depth articles. Instagram will be used for short infographics and alerts. Twitter will be used for community engagement and sharing tidbits of information. TikTok will be used for public relations and showcasing our various talented employees. And of course, now that we're encouraging the company use of social media, we have to also realize that there will be new policies to protect from liability related to how we use social media. There will be no use of personal social media except to share official content if you choose to do so. There will be no commenting or sharing in any form of HIPAA-protected material unless there has been a release form signed. There is no picture taking allowed from personal devices. And remember that for ethical reasons, there must be at least 2 years between having a clinician-patient relationship and a personal relationship with someone. We will be having further in-person in-services on the new policies and procedures related to social media. Do you know what mHealth is? It stands for mobile health, the ability to access health-related records and information via your mobile device. In other words, it's clients having on-the-go access to their electronic health records and interactive data sheets that they can input information that the medical team would like self-monitored. Anywhere a user has a device and internet connection, they can refresh and input their data. This allows patients to become what we call e-patients. This means that they are engaged or participatory and central to their care plan and decision-making. Enabled, meaning that they are able to participate in their care. Equipped, meaning that they have the tools necessary to participate in their care. And empowered, meaning that they not only have been encouraged, but also given the confidence to participate in their care. This will result in better patient outcomes and ultimately an easier flow of care for the practitioners following the patient's case. Ultimately, this shift in procedure is designed to benefit not only you, the practitioner, but also the patients and the community that we serve. I'd like to thank you personally for being a part of the team here at ABC Medical Campus. And if you have any concerns, please don't hesitate to bring them to your supervisors or my attention. Have a nice day. It's as easy as 1, 2, 3 at ABC Medical Campus.